afternoon, Director McCarthy. Thank you for hearing from us today. I'm here representing TriHealth Women's Services and also the Ohio Perinatal Quality Collaborative and Cradle Cincinnati, both efforts to try to impact infant mortality in Ohio. I believe you're familiar with them. I think that many of those who have spoken today highlighted some of the consequences of this program if it was to be put in place here in Ohio. And what I'd like to do is to highlight a few of the things that have happened since expanded Medicaid has been put in place. Recently, with efforts that we've done collaboratively with Ohio Medicaid, we've been able to show that for the first time in many, many years, the risk of delivering a baby premature, especially very premature babies, has gone down in Ohio. That is mainly related to our efforts to work with women who have coverage by Medicaid when they enter pregnancy, and work with preventative services throughout Ohio in many of our large medical organizations to provide care. I am very concerned that if Healthy Ohio is put in place, those women will not have Medicaid coverage when they enter pregnancy and will enter pregnancy care late beyond the time in which we can provide them with preventative services. The Ohio Perinatal Quality Collaborative is going to, jointly with your office, submit a paper to the Journal of the American Medical Association showing that in 2015, we were able to reduce 25% the risk of an African American woman delivering a baby before 32 weeks in the entire state of Ohio. This is a remarkable achievement that is only made possible because of expanded Medicaid. The program, as outlined, will actually deter the effects that we've been able to have on reducing premature birth. Premature birth is the leading cause of infant mortality in the United States, and especially in Ohio. We need preventative care before, during, and after pregnancy for our most vulnerable population of low-income women. In addition, with this change, we would lose the ability to provide inter-pregnancy care for women who have chronic medical problems like diabetes and hypertension. Many of those women would no longer be able to access preventative and treatment care outside of pregnancy and would enter pregnancy in a less healthy state, putting them at much more risk of having complications during pregnancy. Lastly, the ability to provide women with a choice to delay pregnancy, which is one of the effective interventions to spread out spacing by using long-acting contraception, would be decreased if a woman did not have Medicaid coverage, if she could not afford private insurance. So for many of these, all of these reasons, I would strongly discourage the state from applying for a waiver, and know that these organizations that I represent will be sharing all of our concerns with you, the state legislature, Governor Kasich, and CMS if this waiver does get applied for. Thank you.